hospital in Nigeria, teaching hospital in Nigeria, where these students are going to be trained. Okay, we want to also look at the management team in that particular teaching hospitals. We want to see several aspects, several areas, because they need to be going around different sections or different specialty. For instance, we have medical and surgical posting or clinical posting, for instance. We also have ENT posting. We also have psychiatric posting. We also have maternal and child health nursing posting. We also have ophthalmic nursing posting, and we also have orthopedic nursing posting. Okay, these are different specialties that is actually supposed to be in that certified teaching hospital. Okay, that's going to be saddled with the responsibility of training nurses. Okay, this is what is happening in Nigeria. Okay, and it's part of accreditation exercise. Okay, you need to meet the criteria before you could be given go ahead. Now, when I participated in the accreditation exercise in the Republic of Liberia, in Nimba University, okay, this is evidence-based. So when you say evidence-based, okay, do you have this? Bring it, let's see. Okay, I was so impressed, of course, when we asked some of the things that they have. Okay, I was privileged to enter into the labor room and delivery sections, and I saw some of the things they have there, and I was so impressed. Even some of these drugs that are used in prevention of postpartum hemorrhage, for instance, oxytocin, syntocinon, igometrin, we all saw it there. As you see, these are standards that are supposed to be put in place to ensure, okay, prevention of what you call maternal mortality, because this is a very challenge in West African sub-region. Okay, I was told that we have 70 per 100,000 live birth of maternal mortality in the Republic of Liberia. So what are those machinery? So what are those measures we need to put in place, okay, to reduce some of these things? Part of it is the curriculum revisions that was done in Phoebe College of Health Sciences. Okay, in the long run, it will yield a result. That way, it will improve maternal health. You know, they say health is a word. So if a country is healthy, that country is going to be set on the path of development. Okay? Yeah.
Dr. Hada, you want to add to that?
Yeah, actually, the process of accreditation, as I said, is demanding. And what we have found, let me repeat again, is very, very to the international standard. So I want to use this opportunity I have drafted a lot. And very soon, we will have our biennial meeting, that is two years meetings we do in different region of West Africa under West African Postgraduate College of Nursing. So I have jotted a lot of important parameters which, if added to the curriculum of the region, will help a lot to improve nursing education and nursing education, yes, and nursing care.
Okay, so let me come back to you, Madam Flomo. You've listened to them and some of the things they're learning, their impression. Are you taking down some of the recommendations that they're making?
Oh yes, they are working with us, and the standard guys, the internship will require a documentation, because, as he said, World Bank, in collaboration with his institution, is sponsoring this internship for 30 days, and they considered our standard before sending them. So documentation on best practices learned from Liberia, for which they can take back to Nigeria. And like he said, the region, we are all a part of the West African Postgraduate College for Nurses and Midwives. I'm a fellow and also serve on the council. He's also a fellow. And Mr. Kamara coordinated for us next year, Liberia hosts the biannual conference for 6 West African countries. So I was impressed when Dr. Haddad told me that I'm documenting, because we need to also do an abstract on this trip, because we've learned a lot with leadership and professionalism on how your staff and other associate members of your team conduct themselves when it comes to regulation. So yes, we are also taking recommendation. He just spoke about some of our educational policy where we do our post-basic at the diploma level. They are recommending that these post-basic programs, after the students go through the diploma, already move to a university and be able to attain a master's. And with that, you will have high level of education amongst nurses and midwives. And you know, where you have high level of education, you have high level of critical thinking, rationale for doing things will definitely move at a higher level. So yes, we are taking recommendation. Yes, we are documenting. Yes, every process. We are also accepting from them exactly what we need to do to strengthen regulation. As you know, regulation is actually the foundation for anything. Even in your home, Vavle, if you do not regulate the bag of rice, you will soon break down. So that's just a simple example. And that's why at Nursing Board, we say regulation beats our standard. And you saw the trench that Dr. Aliyu took with regulation. It's supposed the human resource for help of any country. And not just human resource for help, but fit for practice. And that is why he told you some of the work we do in supporting the reduction of maternal mortality, infant, and everything that will hamper or will trouble the population's health. Starts with regulation.
Yeah. I will come to you, Mr. Aliyu. You know, the board, as I know it, has done extremely well with regulation, decentralizing state boards. That means the exams, and all that. But the issue has been trying to clamp down on fake and non-compliant nursing schools around in Nigeria. How does it work? How are you being able to, or how are you clamping down on fake nursing establishments? Maybe I mean, Mr. Adatu can also add, because we want to know how can we learn from you so that we can make progress in that.
Even though I did not work directly with the council that regulate nursing and midwifery profession in Nigeria, over the time, what they normally do in trying to identify proliferation of fake institutions running program in nursing. Okay, they have members, colleagues, okay, that are scattered around the countries. Okay. So if they suspect foul play anywhere, okay, they can quickly report directly to the Abuja capital, where we have our council. Okay, so Nursing and Midwifery Council in Nigeria is the one that regulates training of nurses and midwives, and they also ensure that every institution must comply, okay, with the regulation requirements. So it's not just to sit down and open schools and say that you want to run nursing. Okay, over the years, we don't really have cases like that. Institutions running nursing program in Nigeria. But if you talk about maybe fake clinics, okay, that I think we have cases like that, and the NMCI Nigeria is taking a full step in addressing all this. So, you know, Nigeria is a very big country. Okay,
so the schools it's not like that, but the clinics where the problem is.
I think, yeah, even the clinics we're talking about, you may find them in an interior villages.
Okay.
Interior villages.
Where the surveillance level is low.
Yeah, interior villages. Okay.
Mm.
That is where we have something like, but essentially, we record success in ensuring that all our institutions, okay, comply with our regulation and our directive and our requirement. They must certify the requirement before they are given go ahead to commence running nursing and midwifery education in Nigeria.
Okay, Dado had that.
Yes, you know, in Nigeria, the role of regulating the clinics as the nurses, legal nurses, the responsibility of many stakeholders, including National Association of Nursing and Midwifery, as well as Nursing and Midwifery Council of Nigeria. So we have those branches of National Association of Nurses in every part of the country, in every county, or to say state, we use state there in Nigeria. We have them at local government level. So those people are always very, very vigilant about any clinic that open newly. And they went and inquire about the license of the nurses. They don't even they don't restrict themselves to the genuinely of the nurses. They also look at the license, whether the license is expired or not. If license is expired, they sanction the hospitals. That's what they do. Also, other people, ordinary people like us, we also investigate. Sometimes when I go to the hospital, I inquire, is your nurses genuine? They have apparatus license, but they don't have.
The number, nursing number?
No, we use tax.
Oh, okay.
But when you inquire, you can comfortably know if they are genuine or not. If they are not genuine, we have a number to quickly inform the relevant authorities, and actions are quickly taken. So I'm advising the people over here to emulate the same example. When they do that, really, they will control those PEG nurses and PEG nursing school as well as PEG clinics.
Mr. Fluma, I think one of the advantages of Nigeria is the fact that they have the manpower, the population. Yeah, that's an advantage for them.
Yes.
In the nursing field, they have more people than Liberia.
Yes, and the framework they use, like he just said, everyone takes responsibility. So the council regulates, yes, but if a nurse, like he said, each of their state has what we call their nursing body. Here we have it too. We call it the chapter. We have the nurses association chapters all over the 15 counties. Okay. We have the midwifery chapters all over the 15 counties. We have board members. We do not have offices, which even in Nigeria, they have not covered, the offices have not covered the entire country. But what they do, the framework is everyone takes responsibility and report anything that was found told the council. For example, if you will move on and took your family to one health facility, you can ask the nurse who is there and posting as a nurse, can I see your license? Both of them have their licenses. They had to present it to us as nurses legitimate from Nigeria before accepting them here.
And you verified?
You verified it, yes. So then you ask, can I see your license? Look at it. Going forward, you will see a QR code. You can scan that and see whether that person is legitimate. However, if you do not want to go through all of those, you take a phone and call the nursing board and say, I'm interacting here with this person who is a nurse or who has shown themselves or introduced themselves as a nurse. Can you verify? Can you validate? So I usually tell people when they are at facility, let me talk to who you interacting with. Sometimes if they got feedings, I explain to them the rationale why the person is acting the way they acting, and I also talk to the person. So I think the population we have and what we have currently is everyone taking the responsibility to know that the board regulates, and you should have legitimate document to either run a school or to service the population. So I usually tell parents, before you select a nursing and or midwifery school, visit our office. If you cannot visit, check the website. If that school your daughter has told you about is not on that list, that is a fake school. Don't venture, because that initiative will not yield a logical conclusion.
What is indexing? Any of you, do you do indexing in Nigeria?
Nursing and Midwifery Council of Nigeria, which was is actually an act, okay, an act, Cap 143, Law of the Federal Republic of Nigeria, 2004. So one of their core activities is indexing.
Okay.
But there are 6. Number 1, we have indexing, we have examination, we have registration, we have certification, and we have licensing, as well as what verification. So these are their statutory functions. So indexing, okay, is a process where students that have gained admission into a nursing program and that they have spent 6 months post-admission, okay, between 6 months and 1 year, they are expected to be indexed with the council or the board that regulates training of the professions.
That means recognized, right?
Yes, that they already have a student in training.
Okay.
So that it will now serve as an avenue of continuously contacting the progress of this student, because eventually,
is it applied to the school or the individual student? The indexing.
Of course, the indexing, okay, is done by a particular officers of the schools.
Oh, okay.
So he is the one that will do it for all the students.
Okay.
Yes. Okay. So the indexing is done so that when the student is about to graduate, we have what you call licensing examinations in Nigeria. Okay, which you need to sit for the exam and pass eventually before you were given or issued license to practice as a nurse. So indexing is just the first step.
Okay.
The first step is indexing. You are to be indexed as soon as you get, in fact, 6 months after you've already getting admission into studying the program. So you get indexed with the council. So which means it's an official acceptance by the board that regulate your profession, that they've already accepted you, okay, for you to undertake the training in a particular institutions or where you choose to.
Okay.
Yes. So that's what is indexing is all about.
But can you be unindexed if you divert to another profession? Let's say you're doing nursing, you enroll, your particular is taken. Can Nigeria say, okay, you know what, you're not in the program anymore, so your information is no more important? Can that be done?
I mean,
let me come in.
Yeah.
As he said, indexing is a post process of regulating a nurses. When you are indexed, it means you are qualified to be even part of the schools, and you are in the systems. So gradually, if you cannot make it and leave the institutions, that indexing is null and void.
Yeah.
It doesn't make any benefit to you.
Yeah, that's my point.
It doesn't make any benefit to you. But when you are succeeded in completing the programs, then they will license you at the end of the programs, and you become a registered nurse that can work anywhere within the country. And this is what is, I think, is applicable along the region, in sub-region.
Yeah. You want to chip in on that, Mrs. Flomo?
They have just said it, and we started the indexing, as you are aware, like 4 years ago. So we are working with that, and that is like an acceptance. The school in collaboration with the board that yes, you are a nursing student, because remember when you are a student, you also go to the hospital. So we attach, we assign an index number to you. That also you are recognized when you are at the hospital and also at the school. Next month is the last month for us to complete all of our all students, the levels, because like they said, they are 6 months, but ours is 60 days. Within those 60 days, we are collaborating with the school to validate your WIAT certificate, your admission letter, and all of those things that have been written in the standard that you have as a requirement for admission as a nurse. Passing the science courses, making sure that your English and math or other science courses are all clear from WIAT point of view. And then after we do that verification, like they say, you are in this, and then we give you a number. After 3 years or 4 years, based on the length of time the program you are studying, you use that number to now enter the state board link, because only that number allows you to register for state board. So I'm happy that our big brother Nigeria, like they are saying, is also by law that you have to do that. And one good thing I learned probably from them is, if you check right now that the Hada's license, you see that even at the master level, after he came from the basic program, when he did his master in nursing education, first day the school had to index him. After the index, he went, after graduation, he took his exam in master in nursing, psychiatry, master in psychiatry, and then he's assigned a license number. So in addition to his basic number, he also has a license,
The specialized.
a specialized license at the master's level. So that's a very best practice they are living with Liberia. And regionally, we've said, if you didn't regulate that area, how are you going to justify the license you gave? So those are all best practice we're learning. You know, we are part, like we said, the West African Postgraduate, and I'm also a board member for the Africa Institute for Regulatory Affairs. So we use everything from those different bodies, global bodies, to strengthen what we do in Liberia. And all we want people to know is that what we do in Liberia, number one, is according to law. Number two is globally accepted. Number three is according to standard. So we call on everybody to support, because regulation will strengthen our health system.
Okay. I will still stick with you because I wanted to know, as much as they've come to learn and to share their experiences, I just wanted to know what Liberian nurses and midwives are learning from them too.
Okay, so what our benefit of hosting them, right? Hada, do you want to start with what can we benefit
A lot of
while you are
benefit.
here, or even leaving from here, not really the board, but all of the nurses and midwives are the board regulate?
A lot of benefit, both to the universities in Liberia, to the board of Liberia and Ministry of Health. Let me start with the university. The universities that sent us here do also receive students from African countries to study. We have a fully funded program that each and every African students who has that basic qualification
That's it.
can directly Google into the website, enter, select the course, apply, and he'll be funded fully. When we are coming from Nigeria, in the airport, we met some Liberians who are coming from the same university we come. So we had a discussion with them. They are enjoying the same scholarship. So that's the benefit to the university. And any university that offer health, it's not only nursing, that offer health like nutrition, like psychiatric, mental health, psychiatric, like maternal health, can assess the package and they can benefit from the package directly. Secondly, to the board, we are going to have a partnership with them. so that we can be exchanging some updated knowledge between between the Department of Nursing as well as the Board of Nursing and Midwifery in Liberia. So we are into that process.
Yeah, Mr. Aliyu.
Maybe if I should just add to what he has said. Like I said before, the name of our center in Nigeria is African Center of Excellence for Population Health and Policy.
Yeah.
So this center run master's degree program in some selected specialty. Okay, one of the specialties is public health nursing and policies at master's degree level. Others are maternal and child health and policy, including also public mental health and policy, as well as public nutrition and policy. So these are programs that are funded by the center on behalf of the World Bank. Okay, it is meant for students across the West African sub-regions. Okay, so now the essence of this program is for training manpower, especially in area of maternal and child health. Okay, this will go a long way in addressing issues that has to do with maternal mortality as well as neonatal deaths, because these are indices, these are parameters that do not speak well as far as our healthcare system delivery is concerned. So that's why the center is training manpower in some selected area. All this area has a direct bearing with population health. You're talking about public health nutrition or public health mental health and policy, maternal and child health, or public health nutrition, public health nursing. So all these address population health. So these are benefits that Liberians can also benefit. But for me, my staying here, okay, like I said before, okay, I gain a lot of experience here, okay, because when you are in your home, you don't know how things are done elsewhere. But when I come here and I see how things is also done differently from my home. So I have a lot of take-home messages that when I go, I also share with my people.
So that's
yes.
so.
Yes.
Thank you, Aliyu, and that's
Yes.
why
Yes.
I wanted you to get it for themselves, because this is a huge benefit to Liberia, because they are saying the university from which they come, masters and PhD in those different areas, because the regional data actually showed some weaknesses in these areas. And one of Liberia's limitation when it comes to the nursing and midwifery has to do with specialty programs. We have like just 5, and they have over
Many.
yeah,
Many.
they have many. So the region has been they have screened the region and have seen these areas need to beef up. And the benefit to the universities, and that's why I'm here this morning to call on all nursing midwifery colleges, universities, schools. They have interacted with like 3, Grand Bassett, Nima, Bonn. It will be good for them to make use of this opportunity. It's a World Bank project. It's right there in Nigeria. You go down the link and apply. Let your faculty, because to open new specialty programs, you need faculties. You remember we're talking about accreditation, and we are told you we cannot assign time because it takes all of these preparation. But now they are saying, send your faculty, let them have masters, let them have PhD free from leaving from the airport. We have some Liberians who are benefiting. I hope if some of them are listening, they can call. From leaving to the airport, down to dormitory, down to study and books, Aliyu Ada have assured that they're all free. World Bank pays for that right at the university. And they have different centers.
ASIPAP.
Yes, so the link is available. They may call the link here, and you can contact us. Let's use this. And the nurse and the midwife that want to, but like you see, that meet They are strong about meeting the requirement and the standard. They are strong requirement. We won't discuss that now because we do not have the time. But visit the website and make use of it. And come by to support your country nutrition. You need to come by and let Vavle know what he is supposed to eat in the morning. That will be healthy for him. Maternal and child health. Our maternal mortality is way high. How can we have these people? Leadership, policy, like Hada said when he started speaking. Sometimes our system just lack the requisite leadership. So our system crumbles because of lack of appropriate leadership. So let's make use. I think it's a huge benefit for hosting them. At least when they told me they were coming for 30 days, and I was informed that they have this center in different areas in Nigeria that will train the region nurses and midwives in these specialty areas. I took that as a high plus for the nursing board and for all of our people to benefit.
Yeah. Okay, so
Thirdly, there are unfunded programs
Okay.
at higher level. As I said, we have gone far in masters and PhD in nursing. So like we are ahead of Liberia and many other West African countries. Students from Liberia can also benefit from the package. When they get admissions, they can get sponsorship anywhere, or they can even be sponsored. I don't know whether the Liberian board of nurse and midwifery. So they can get sponsored and study these programs. We have many universities that offer them. Secondly, there are also very, very important specialty that offered by our teaching hospitals, such as critical nursing care, accident and emergency, orthopedic nursing, renal nursing, which are not
brain,
and many of them. So they can get access to them, get sponsorship, and come down to Nigeria to benefit from the program.
Yeah, Dr. Aliyu.
Yeah,
you say you wanted to say something.
I just want to emphasize manpower capacity building is actually the key. Okay, in running a smooth healthcare institutions. So capacity building cannot start overnight. So it takes a lot of time. When I was in Nimba, I saw a particular fellowship, a particular lecturer, okay, who is also in my field of specialization.
Wow.
I'm specialized in medical and surgical nursing, PhD. That is my specialty. So I watched this man teaching students in the classroom. I was so impressed. I was nodding my head throughout the period he was teaching. He didn't know that I belonged to the same specialty with him. Until when he eventually finished his lesson, we now started interacting. And he told me that, why am I nodding head while he was teaching? I said that it's because we are in the same specialty. He was so happy. And the next thing is, he told me that he has a master's degree in nursing and he's looking forward to have a PhD in medical surgical nursing. I said, oh, yeah, I'm already a PhD. I can even graduate if you come to my institution. So and I'm sure he's making
So you took your number, he took your number.
He's making an effort to see how even the institution is ready, okay, to partner with Nigerian University, where I come from. And we are looking forward to seeing something like that coming into a very good area.
Let's see if we can take one or two calls, and then we'll go back to you. You can just read it. Maybe the link that you're talking about, if you have it. If not, then you can go on the website and see. But you can call us on 770-581886, 0770-581886, and be live. This is the Super Morning Show on ELBC Radio. We have our visiting guests from Nigeria, a guest of the Liberia Board for Nursing and Midwifery. So I mean, how can one access the link so that they can get in contact?
Yeah, it's very simple. So I advise people to just Google search African Center of Excellence.
Okay.
African Center of Excellence.
Yeah, I mean, I can read it from my end here.
African Center of Excellence for Population Health and Policy, Bayero University, Kano, Nigeria.
Okay.
if you Google search, it will bring you every information. Then you start clicking on their available program
You want-
for masters, the one
What
you
you want
want.
to
So it
apply.
will just come up. So even the direction for admission is there.
Mm.
We also have some of our Liberian contacts. And they can also share information regarding the application process.
Mhm.
Yeah.
They can contact the registrar,
Oh, okay, Mrs. Flomo.
Yes.
Mrs. Cecilia Flomo.
Yes, I even had one in my class recently.
Oh,
He's
okay.
from Liberia. He's
Oh, okay.
studying public health nursing.
Mhm.
Yeah, he's from Liberia. It's all I don't have his that one, but I have other numbers.
Okay. Yeah. So Bayero University in
Kano,
Kano,
Nigeria.
Bayero University. Just
That's
look for
correct.
it.
That's
Yeah.
correct.
Yeah, and the African Center of Excellence for Population Health and Policy,
Yes.
ACIFAT. Gentlemen, Mrs. Flomo, I'd like to say many things. Maybe I can just your parting comments, and they can all end from their end. Yeah.
As always, we want to say thank you to ELBC, particularly you, Mr. Kamara, for being the nicest and midwives friend, always hosting us to inform our population. And also thank the Liberian Board for Nursing and Midwifery for giving the approval through our board chair, Mr. Humphrey Gibbs Lowell, for hosting our brothers for like 30 days. We will just say, let's make use of the partnership. Let's make use of the opportunity so that we can build Liberia in a way that the nursing and midwifery landscape will be of quality and we will serve our population. Hada Aliyu, we also enjoyed your stay here. We thank you for your willingness to learn and to teach us. Thank you.
First of all, let me express my gratitude and appreciation to Madam Cecilia Flomo, Registrar, Liberian Board of Nursing and Midwifery. In fact, he gave us a very befitting, warm reception when we came for a couple of weeks now. So she has just been like a mother to us, and she's taking a very good care of us. And I'm indebted to her.
Okay.
I'm indebted to her. Yeah.
It's-
May God Almighty reward her abundantly. Thank you for, and also our host. I also appreciate you for giving us this platform.
Yeah, sure.
Okay, to say one or two things to our fellow West African sub-region people. Thank you very much.
You're welcome.
Mine is also gratitude and thanks
Mm.
to the Liberian Board of Nursing and Midwifery for making us at home. We really feel at home. So thank you for that. Secondly, let me thank the entire nurses in Liberia for also giving us cooperation to see a lot of their works, their facility, and so on and so forth. And thirdly, let me inform the healthcare provider and nurses in particular that next year, 2025, we will have our program, West African College of Nursing program, taking place here in Liberia. So I'm employing each nurse, whether it's a fellow or non-fellow, to come and see what we are doing so that we can join hand and make our region better. Thank you very much.
Thank you.
for
Thank you.
hosting us.
Thank you very much. They are guests of the nursing board, Dr. Haddad and Dr. Aliyu. Many thanks to all of you. My name is Vafle Kamara. Join the team tomorrow for another presentation of the Super Morning Show. Bye-bye.